Hi, I'm Shantanu. I'm co-founder of CareNX Innovations. At CareNX, we develop technologies for doorstep delivery of healthcare, and major of our focus is on connecting sensors with the smartphone. The whole idea is using the mobility and computing power of smartphone and enable better healthcare access to the people who are not able to get proper healthcare at doorstep or even in the nearby facility. The first product that we are working upon is called Care Mother, a mobile pregnancy care solution to provide doorstep maternal care, early identify high-risk pregnancies and save the complications in 0 to 9 months. When we try to look at the Indian healthcare system or overall healthcare market, there are certain challenges that we realized. It starts right from the idea, conceiving that idea, taking it to the next step, involving the doctors or healthcare people inside those ideas and trying to scale them, or trying to understand who is your customer is also one of the bigger challenge. It's not that easy on the day one that you know that he's your customer, or being a student or starting some innovation based upon the need. Sometimes you have to figure out who can be the best customer, and then you realize that the customer and the ecosystem or the economics doesn't meet. That brings up a lot of challenges, and you have to again put the paper, try to figure out all other possible options, meet the people and come up with a new business plan, or try to solve some problems on ground by meeting some other people. There are different challenges in terms of policy level also, or the healthcare ecosystem. What we have is majorly government structure in terms of rural areas, and in urban areas more of a private hospitals or entities who are operating in this region. So both segments are different. If you're trying to build a consumer product, that's again a different ball game. So three type of customer segments that you have that exist in Indian healthcare system, and when you start something, considering that you have to create an impact on bottom of pyramid, or probably build a solution which can provide better healthcare access or solve the issues of the healthcare infrastructure, then you really need to figure out who is my customer, and out of these three, to whom I should start with, and then it should make sense for raising the fund or getting the grants, and the most important challenge is sustainability that you have to show on paper as well as off the paper. Yeah, so I really appreciate the initiatives taken by the government. There are a number of initiatives through Department of Biotechnology or overall Startup India program that are helping healthcare startups and in general all the enterprises or startups in India. This is a really good plan. There has been talk about the tax exemption, which is definitely going to help. But a startup of year 1 or 2 age, for them the need is more than that. Some of them try to reach out to the prototype of commercial stage. Some of them enter into a commercial market stage. But the real challenge is when they build a solution, and particularly when we talk about health, people are trying to develop the solution to reduce the cost, create the affordability, increase the access, and reach out to the people in the areas where there is no proper healthcare access. In that case, the major partner or customer is government. And now when we are talking about the policies and changes that is brought by the government, somewhere for the startups to pass through a tendering process or getting their innovation noted by the different government agencies. In India, healthcare is a state matter again. So a lot of challenges coming for one startup to reach out all these different segments. So there is a need of a platform where either government works with the partnership with some organizations and allow them to practice their innovation. And one of the example is Wish Foundation is doing with, or a couple of other organizations doing with the government of Rajasthan. So similarly, if there are more platforms like this, focusing on some thematic approach would be a really great help. I also feel particularly about innovation policy, which I heard and read in one of the newspaper, that government of Maharashtra with State of Innovation Council coming up with one of the new policy where if the innovation is certified by the Science and Technology Park in Maharashtra, that this innovation is made in Maharashtra, they need not to pass through a tendering process, and there will be a quick procurement process for these startups or innovations. something like this would really help to survive the startups in the early stages of life, and also become the partner with the government. That will also boost the confidence of the investor as well as other people that these kind of solutions are being accepted and can be scaled at the larger level. So this is more of my personal observation. So we have seen a lot of Me Too innovations as well, and people are coming up or trying to replicate some models from abroad to here, or apply some market space. But if we try to look and compare some analogy, let's take an example of Paytm. It has got a good history of doing a lot of groundwork, and it's not only the technology innovation, that has been a lot of operations things that has done at the back end. And I feel the service plus technology innovation component really works in this country, or even in our space in healthcare. Practo has done a lot. So something that involves the transaction with the humans, as well as having that human component and technology as an accelerator, would really help in this space, I feel. Mistakes are part of the startups. I feel they should happen at the as early as possible. And the strategy that what KRNX learned is fast failures, or you fail fast and try to learn as soon as possible, and try to restructure yourself. So mistakes are there, and at KRNX we have done a couple of mistakes, understanding the ecosystem or understanding the customer. Were certain challenges that for us, and even for the team, we realized that we need to have a different team and motivated team to work on these kind of challenges. So there are certain mistakes or certain challenges that we made, but that doesn't mean that we failed completely or we have to stop our operations or something. And that situation comes for major of the startups at the early stage, where some of the times people feel, is it the time to close down, or reach out or try out different models. And in that stage, if they want to bounce back, there can be a number of things. So it's not necessarily everyone will be able to bounce back. It depends upon the product nature and the services they are involved into. But it's possible if we learn early, then there is a possibility that we come back. But there are certain challenges in healthcare space. It requires a lot of process through you have to go. For example, some certifications, or you need to clear out some validation studies. And after all doing these things for 1.5 years or 2 years, then you realize this is not the right product, or even you can't reconfigure it and represent to some different customer segment, then it's difficult to bounce back. Traditionally we've been IT nation, and it's always easy to understand the investor and the people in this space to invest or get the idea that how the startup can grow. So it's been easy to invest in IT startup. In healthcare, when it comes in terms of services or product and combining IT with them, there's been a little challenge that we have also faced in terms of reality. But apart from that, I've seen there are certain changes those are happening, and to come up with the new ideas or innovation apart from IT, or inclusion of IT with different products or services, it not necessarily comes from only IT background. There are people who are coming up very good ideas or innovations. The thing that helps in IT is there is already established ecosystem or platform where people can leverage it and build the solution very faster. But it does not mean they are delivering the right value. And for the new ideas or innovations where people are from non-IT background, there are a lot of platforms. And just to mention one, BIDAC, which is an agency in the Department of Biotechnology, is giving grant for your idea to prototype stage. And these programs are definitely helpful. When you have an idea, we have done a little work on that, you can definitely pitch those ideas and get the fund, start doing research and validation. And for investors to come into the picture, or funders, they try to see if it's an healthcare idea, they want to have it validated, and then they will pitch in. So once you have the validation, a lot of people will come to you, and for getting validation you need funds. So it's a chicken and egg situation, but basically if you crack that with the initial investment from the government or it's a grant, and build that validation studies, then it will be easier to get the investment in this way.